morning, everyone. Thank you for the opportunity to present at the Paris International Oral Microenvironments Conference. Today, I will discuss the different genomic, proteomic, and cellular mechanisms that contribute to the shortened survival time of dental restorations in patients with dry mouth. As highlighted in the study titled The Survival Time of Restoration is Shortened in Patients with Dry Mouth. Introduction to xerostomia. To begin with, xerostomia or dry mouth is a common condition affecting approximately 22% of adults. It encompasses both the subjective sensation of dry nails and hyposalivation, which is the pathologically low production of saliva. Notably, patients with unstimulated salivary flow rates below 0.2 ml per minute experience a higher prevalence of caries and xerostomia. The most prevalent causes of dry mouth include shortened syndrome and radiotherapy to the neck or head. However, medications, especially polypharmacy, are often employed as well. Age and gender also play significant roles, with older adults and women being more frequently affected. The implications of dry mouth and oral health are profound. Research indicates that restorations in patients with xerostomia have a significantly higher failure rate. In fact, the study found a hazard ratio of 2.08 restoration failure in dry mouth patients compared to controls. This means that these patients are more than twice as likely to experience restoration failure. Genomics mechanisms. Now, let's delve into the genomic mechanisms at play. Salivary gland function is regulated by baby genes, including those responsible for salivary secretion, such as aquaporins and masses. In xerostomia, there is often down-regulation of these genes, leading to reduced saliva production. Furthermore, inflammatory cytokines like IL-6 and TNF-alpha show increased expressions in patients with conditions like Sjogren's syndrome, exacerbating gland dysfunction. Proteomic changes. Moving on the proteomic changes. Xerostomia alters the composition of saliva significantly. Patients often exhibit increased levels of protective proteins such as lactoferrin and lysozyme. These proteins play crucial roles in antimicrobial defense and tissue repair. The reduction can lead to an increased risk of caries and compromised restoration integrity. In cellular mechanisms, at the cellular level, xerostomia leads to notable histopathological changes in salivary glands. Ductal cell hyperplasia and acinar cell atrophy are commonly observed in affected individuals. These changes impair cellular signaling pathways crucial for saliva production and secretion. Effects on restoration materials. The survival rates of different restoration materials also vary significantly in xerostomia patients. What it means? It's like fixed prosthetic crowns tend to have better longevity compared to composite fillings, particularly large composites that are more susceptible to wear and failure due to reduced lubrication from saliva. Clinical implications. Understanding these mechanisms has important clinical implications. When treating patients with dry mouth, dental professionals must consider these factors when selecting restoration materials. Personalized care strategies can help mitigate risk associated with restorations failure. Future research. Looking ahead, further research is essential to explore potential therapeutic interventions aimed at restoring salivary function through genomic or proteomic approaches. Longitudinal studies will also be necessary to evaluate the long-term efficacy of various restorations materials in this patient population. Okay, and finally, to conclude this presentation, we have our conclusion. Xerostomia significantly impacts the survival of dental restorations through a complex interplay of genomic, proteomic, and cellular changes, as I explained in all our presentation. As we advance our understanding of these mechanisms, we can enhance our clinical approaches and improve outcome of patients suffering from this condition. Now you can see the reference used to do this presentation, and I want to thank you for your attention. I look forward any questions you have regarding about this important topic. You can send this in the comments in this video.